Next one is subcutaneous implants. So these subcutaneous implants are also containing the artificial what? The hormones like progesterone or progesterone itself, right? And such kind of hormone containing a small matchstick sized. So capsules are inserted on the lower side of the upper arm above the elbow itself, and these are secreting or they are releasing slowly the hormones into the bloodstream that avoids the implantation as well as what? So ovulation itself. So that what happens? There would not be any pregnancy in the woman. And these, so the implants, once they are inserted, then they survive or they will be there for about, and they will be more effective for about 5 years in that woman, right? So this is about what? Subcutaneous implants, we can say, right? So and the next one is hormonal injections. These hormonal injections are also taken over here so as to avoid the ovulation as well as implantation or avoid the pregnancy itself, right? So hormone like, once again, progesterone. This injection contains mainly the derivatives of progesterone hormone, and it is taken once in 3 months, right? Once in 3 months it is being taken, and it is also doing the same job of subcutaneous implants itself, right? So this is how pregnancy is avoided through hormonal injections also. And the next one is emergency contraceptives. This is more important one. Emergency contraceptives, EC it is said as. And such kind of emergency contraceptives are of different kinds. So let us see now. I pill as well as unwanted 72, such kind of many emergency contraceptives are given over here, and these avoid the ovulation, and such kind of emergency contraceptives are taken by the female. So during some situations like unprotected or unsafe sexual intercourse, or it may be so break of the condoms may take place. Sometimes what happens, rape may occur over here. That moment immediately such kind of emergency contraceptives are given to the women so as to avoid the pregnancy over here. So all these are nothing but birth controlling measures, especially the temporary methods so as to avoid the birth control, so as to avoid the pregnancy in the women itself, right? So and the next one is permanent methods. What are these permanent methods? What are its types? All those things, so we'll see in the right. So let us go through it. Permanent methods. These permanent methods are also named as sterilization methods. Sterilization methods are also known as surgery methods. Surgery methods, right? Why these are called as surgery methods is because, so by surgery only the permanent stoppage of the pregnancy is being done in case of both male as well as female, and certainly so they are also named as sterilization methods. Why? Because here the male as well as female are made sterile over here permanently, hence this is called a sterilization method, and these are permanently happening over here. That is why these are called as a permanent methods. And let us go through the first permanent method, that is vasectomy. Vasectomy is usually done in case of males, and second one is tubectomy. Tubectomy is done in case of females. Okay, so what are these surgeries? How these been done? These have been done in case of both male as well as female. Let us go through. So what is done initially is here in case of male was deference, you know it better. It is one of the accessory duct present in the male reproductive system, right? And this was deferens is cut over here. It is cut and tied apart, so that what happens, there is no transportation of the sperms from the testis to the abdominal part, especially the urethra, or especially to the penis itself, right? So hence this is the small operation, small surgery which is done through the scrotal sac. Suppose, so this is the scrotal sac of male and this is the second scrotum, a pair of scrotum in which a pair of what are present over here, testes are present over here. On the testis, on the dorsal side, you will find this kind of what was the difference that you come across over here, and this was the difference what you come across over here is cut. When it is cut and it is bent like this, and later it is being tied over here, so like this, then automatically what happens, there would not be a possibility of what, there is no possibility of what, so transportation of the sperm from this testis to the abdominal part, right? With adjacent to this one, there you come across what, penis over here, right? You will find penis over here. So like this. So this kind of operation is being done in case of males, and certainly in case of tubectomy it is done in case of females. So tubectomy, the name itself suggests that here the fallopian tubes will be there, and these tubes are also cut and they are also tied apart. When these are tied apart, then there is no chance of mating both male as well as female. So gametes over here, then there is no pregnancy automatically, right? So you are observing here, this is the female reproductive system, what you are observing here, right? This is the female reproductive system. Okay. This is what I am saying is female reproductive system. In this female reproductive system, both these fallopian tubes are cut and they are tied apart. They are cut and tied apart, so that what happens over here? What happens over here is, so there is no chance of the egg cell or the secondary oocyte which is so released into the fallopian tube, it would not reach the uterus over here itself. So that what happens, permanent stoppage of the pregnancy is being done in case of female also. This is called as what, tubectomy, and this is called as what, vasectomy, right? A small surgery is being done in the abdominal part of the female, so where the fallopian tubes are present, and those fallopian tubes are cut and they are tied apart over here in this case of tubectomy. Very simple surgery is being done in case of females, right? So this is about the sterilization methods or the permanent methods, or they're also called as surgery methodologies, right, of contraception, right? So this is about the permanent methods. And so as you know, these are the contraceptive methodologies, and these are undertaken under the guidance of a physician or the professional. So then only it is possible to make this one successful always, right? So one thing we must know the point. That is, under the guidance of the doctor only, we have to follow such kind of either the temporary methods of contraception or the permanent method of contraception. This is one fact to be done, right? And second one is, so one is to force to use these contraceptives so as to make the space between the pregnancies, as well as so as to prevent the pregnancy sometimes, and permanently stop the pregnancy sometimes, right? And so one more thing you must remember over here is, these are not the permanent solutions for maintenance of reproductive health. These are only practiced against the normal natural reproductive cycle or events what are happening, like the pregnancy or the conception, right? So as to stop the conception, so as to stop the pregnancy, we are using these are not the permanent solutions so as to maintain the reproductive health in case of human being, right? Of course, these methodologies have many number of drawbacks are there. We have already discussed these drawbacks whenever we were discussing the IODs. So there is a lot of bleeding, menstrual bleeding, so take place, menstrual imbalance take place, right? Breast cancer also occurs due to use of such kind of contraceptive methods, right? All these are the drawbacks. Of course, they are also very important to remember. So as to avoid these one, so as to avoid them, we have to struggle actually, but these methodologies are the ultimate methodologies so as to make the space between the pregnancies, so as to prevent the pregnancy, or so as to stop permanently the pregnancy itself, right? So this is all about the temporary as well as permanent methods of contraception. Some more aspects we must remember regarding these contraceptive methods. They are simple. Number one. So what is that is? The selection of the contraceptive method is done under the guidance of a doctor, that is medical professional itself. This is the point to be noted. The selection of contraceptives is being done under the guidance of a medical professional. One thing. And one more thing is, these contraceptives are not the regular requirements for the maintenance of the reproductive health. Contraceptives are not regular requirements for the maintenance of reproductive health. And third one, so these are done only against the natural reproductive event itself. What is that event? Is conception, or it may be pregnancy. They are simply done against a natural reproductive event like conception or the pregnancy itself, right? And one more thing we should remember over here is, one must be forced so as to use these contraceptives. One is forced to do or follow these contraceptives so as to prevent pregnancy. Sometimes so as to space pregnancy, right? So as to delay pregnancy, right? All these are the reasons why these contraceptives are used over here. And these contraceptives are nothing but these are population controlling measures. These are one kind of population controlling measures. Okay, they help in controlling the population, right? Even though they help in controlling the population, right? So these have some of the ill effects, means they have some of the drawbacks. So they are breakthrough, bleeding is there, irregular menstrual bleeding occurs due to use of this one, right? Abdominal pain occurs, nausea occurs. All these are the drawbacks of these contraceptives itself, right? So this is all about the different types of contraceptives what we discussed till now itself. Thank you.